All right, let's get right into it. Today, we're talking about something that affects millions of pregnancies, gestational diabetes. We're going to break down what it is, how it's handled, and, the really big question, what does it mean for mom and baby, both now and way down the road?
Think about it. Building a whole new person is, well, it's just mind-blowingly complex, and it puts a huge strain on the body. This question really gets to the core of what we're talking about today. It's all about how the body handles its fuel, sugar, when it's under the incredible stress of a pregnancy.
So what's actually going on in the body? Well, a simple way to think about it is this. Insulin is like the key that opens your body's cells to let sugar in for energy. But during pregnancy, you've got all these other hormones floating around that can kind of get in the way, blocking that key. Normally, your body just goes, okay, no problem, and makes more insulin. But if it can't make enough to keep up, well, that's when sugar starts to build up in the blood. And that, right there, is gestational diabetes, or GDM. Okay, so if this is all happening on the inside, how do doctors actually spot it? It's a great question, because it doesn't always have obvious outward signs. That's why the whole diagnostic process is set up to be super thorough and, most importantly, to catch it early.
So here's how it usually works. It's typically a two-step process. First up, there's a screening test. They might check your blood sugar right after you've eaten. That's all postprandial means, just after a meal. If that first check raises a little red flag, then you move on to the big one, the oral glucose tolerance test, or OGT. That's the test that gives a definitive yes or no.
All right, so once there's a diagnosis, the game changes. It becomes all about managing the numbers. And this right here, this is the magic number. The big goal is to keep your fasting blood sugar, that's your level when you first wake up before you eat, under 95. That's the target for a healthy pregnancy. On the flip side, a number like this tells a very different story. You wake up, you test, and you see 129. That's a clear signal. It tells your doctor that your blood sugar is officially in the diabetic range. And that means it's time to get a proactive management plan in place, like right now.
But look, a diagnosis isn't just some scary label. It's really the beginning of a new chapter. It's a call to action. So let's talk about what that proactive plan actually looks like, the one that's all about keeping both mom and baby healthy. Now, for women who already have diabetes before getting pregnant, the prep work starts way earlier. We're talking about getting that long-term blood sugar number, your HbA1c, really under control. It means taking a higher dose of folic acid to help protect the baby and getting special checkups for your eyes and kidneys. It's all about making sure your body is as ready as it can possibly be for the journey ahead.
Okay, so the first tool in the toolbox is always what's called medical nutrition therapy. Basically, a careful plan for diet and lifestyle. But, sometimes that's just not enough. If blood sugar levels stay stubbornly high, or, and this is a big one, if an ultrasound shows the baby is getting a lot bigger than average, a condition called fetal macrosomia, well, that's a clear sign that it's time to bring in some extra help. And the response to that signal is very clear and methodical. Step one is always to go back and take another hard look at the nutrition plan, see if anything can be tweaked. But if that still doesn't get the numbers where they need to be, then the safest and most effective move is to start insulin. It's the go-to for helping the body get that sugar under control during pregnancy. And this is so important. Safety is everything here. There are tons of different diabetes medications out there, but you can't just use any of them during pregnancy. This one here, glibenclamide, is a perfect example of an oral medication that's a definite no. And this really highlights why insulin is the standard of care. It's because it doesn't cross the placenta to the baby. It's all about safety first. So why all this careful management? Why all the focus on numbers and plans? Well, it's for one very important reason: to steer clear of the potential risks and complications that can happen if GDM isn't kept under control. Let's talk about the baby first, because the risks are real. We've already mentioned macrosomia, which is just a fancy term for a high birth weight. But then, after birth, the baby can have the opposite problem: low blood sugar, or hypoglycemia. And that's because their little body got used to pumping out extra insulin to deal with all the sugar coming from mom. Other things doctors watch for are jaundice and even a condition called polyhydramnios, which means there's too much amniotic fluid.
And it's not just about the baby. The risks for mom are serious too, both during the pregnancy and long after. We're talking about things like high blood pressure and a tougher delivery. But honestly, here's the biggest takeaway, the thing you really need to remember. Having GDM is like getting a crystal ball for your future health. It is one of the strongest signs that you are at a much higher risk for developing type 2 diabetes later on.
So the baby arrives, and you'd think the story's over, right? Well, not quite. That GDM diagnosis sticks with you. It has implications that really last a lifetime, and it means moving into this next chapter of life with a whole new level of awareness.
Okay, let's talk about a super practical, real-world scenario. Imagine this. You're 6 months postpartum. You had GDM. You check your fasting blood sugar and it's 120. That's in the pre-diabetic range. Given that health snapshot, what's the smartest choice when it comes to contraception?
In a situation like that, the intrauterine device, or IUCD, often becomes the top recommendation. And the reason is really straightforward. It's non-hormonal. That means it's not going to mess with your weight or your blood sugar. Compare that to something like the pill, which has hormones that can potentially impact your metabolism. It doesn't mean you can't use them, just that you have to be a lot more cautious.
You know, it's so important to understand that GDM doesn't just pop up out of nowhere. It's all connected. It's often linked to other things, like polycystic ovarian syndrome, PCOS, and that's because they share the same underlying issue, insulin resistance. It all just circles back to that main point. GDM is a powerful heads-up from your body that you're on the path toward type 2 diabetes later on.
And that really brings us to the final, and maybe the most important question of all. Is this whole thing just a temporary problem that goes away after the baby is born? Or is it something more? Is it a crucial signal for your future? The answer is, it's a signal. It's an early warning. But you know what? That's not a bad thing. Think of it as a preview of your future health, a preview that gives you the incredible power and knowledge to take control of that future starting right now.